Hello, this is Dr. Gay from First Lake MRI, and this is an 18-year-old male with injury recently, knee pain, and he has a very common mechanism of injury. And in radiology, you see lots of patterns. This is one of those common patterns. So just with a quick glance, you can tell what's going on. And so here it is. This is a coronal view where we see the femur up top here. We see the tibia down below. The lateral side of the knee is here. The medial side is over here. And so the two things that stand out are on this image. There is a bright band of signal here. This is fluid, and it's going between the femur and the medial collateral ligament. So this is the medial collateral ligament on the medial joint line. It's completely torn, separated here with a little bit of fluid. This is a grade 3 injury where the MCL is just non-functional because it's torn and uplifted. And also there is marrow edema in the lateral tibia. So the patient has a valgus stress injury. The tibia went out lateral. It impacted over here. We only have the bruise on this part. Sometimes you also see a bruise down on the tibial side. And then you have the distractive forces on the medial side that tear off that medial collateral ligament. So a very common mechanism of injury. Oftentimes they have a tear of their ACL or PCL. This patient has a torn anterior cruciate ligament. Here's the PCL intact, and the ACL is torn. This patient also has this interesting little finding here. There's a little bit of marrow edema right here, and this is a little cortical avulsion. Some of the supporting ligaments, the joint capsule attaches over here, and it tore the periosteum. So there's a little cortical or periosteal avulsion fragment, a little teeny bit of fluid there at the attachment. So a little tear here. Usually you don't see this with this injury, but medial collateral ligament tear, impaction injury means a valgus stress injury. A lot of times with those, again, you get the ACL tear, which we can appreciate here. This is the ACL. Instead of being nice and straight, it's thick and it's lax. It lays horizontally here. Now we're going to go to another patient who has a similar mechanism of injury. Again, this is a common pattern to recognize. Again, here's that lateral impaction injury, medial collateral ligament sprain. Now we're going to go to the next patient. So this is a 16-year-old patient. The last one was 18, and they have a very similar mechanism of injury. We see this thickening along the medial joint line. This is the medial collateral ligament. The images are a little blurry from motion. If we put up a fat suppressed sequence, we see lots of motion, unfortunately, but the medial collateral ligament, now we can see it's intact up high, and it ends here, and this is fluid, so it looks like it's completely torn from the tibial attachment, another grade 3 MCL injury. It's non-functional. And if we look over here, we're going to look for that impaction injury. Very subtle impaction injury here, just barely discernible. But again, the same day, different patient, similar age, with the same mechanism of injury. Now we're going to look for that ACL tear. The ACL is fine, but in this patient they have a Pcl tear. This is the posterior cruciate ligament. So a MCL rupture and a Pcl rupture. This is the anterior cruciate ligament, just looking pristine. And the posterior cruciate ligament is here. It goes up and wants to come down here, but instead we see this fogginess here. We don't really see it here. So they have a torn PCL. And again, the common mechanism of injury, valgus stress injury, where there's distractive forces along the medial side with a tear of the MCL, often an associated tear of the ACL or PCL, and that typical bone contusion over here on the lateral side. Thank you very much.